Everyone, so today we are going to be learning about pancreas. Pancreas can come as a 10-mark question in exams. So we will be learning about all these things listed below about the pancreas. We will be learning about its position, parts, peritoneal as well as visceral relations, which is very important and usually very confusing. The ducts, blood supply, which includes both arterial as well as the venous supply, lymphatic drainage, development as well as applied anatomy. So in this video you will be learning about pancreas. It can come as a 10-marker question also. So first let us get started with the location of pancreas. First, the first thing is that it lies horizontally on the posterior abdominal wall in the epigastric as well as the left hypochondrium regions. If you guys do not know, so this is how the abdomen is divided into 9 quadrants. This is just a rough schematic diagram that I have drawn. So the center part is nothing but the umbilicus. This side is your right side and this is the left side. So this will be the right hypochondrium, this will be the left hypochondrium, this is the right lumbar, left lumbar, right iliac fossa, left iliac fossa. This is the epigastric, umbilicus as well as hypogastric. So roughly the pancreas lies between the left hypochondrium. They're telling it lies between like the left hypochondrium as well as the epigastric region. In this region is where your pancreas lies. Okay, and then it crosses the posterior abdominal wall obliquely from the concavity of the duodenum to the hilum of the spleen opposite to the level of T12 to L3. So behind you have the vertebra, right? So this you can look at this diagram. So they are telling that it lies between the concavity of the duodenum. See, this is how the pancreas lies, and up to the spleen. This is the spleen, and you can visualize it in the sense it lies between T12 to L3. This is where it lies between. So this is about the location of the pancreas. Moving on to the gross features. Coming to the parts of the pancreas, the parts of the pancreas are, it has 4 parts. The head is considered along with the uncinate process. Okay, so what is uncinate process? This part of the pancreas, this is a rough diagram. So this part of the pancreas is known as the uncinate process. The next part is the head, next part is the neck. It connects the head as well as the body. The next part is the body. This is usually the largest part of the pancreas, and it has one process, that is nothing but the tuber tail, and the next part is the tail. So the next, coming to the next subtopic, that is the relations of pancreas. This diagram is very, very important. If you understand this diagram, the relations will be very easy to visualize as well as to write, and you will not be forgetting the relations. So this diagram is very important. This is nothing but the duodenum, and these are the 4 parts of duodenum: first part, second part, third part, and the fourth part. Between that is what lies the pancreas, right? This is the this is the pancreas. Now as you can see, this is nothing but your IVC is nothing but inferior vena cava, and this is the aorta. And then on the aorta you can see the celiac trunk. From the celiac trunk you have the splenic artery that is coming. This is the splenic artery, and CHA is nothing but this is a common hepatic artery. And then behind, these are all the posterior relations. This is all present behind. So this is nothing but your left kidney as well. This is the left kidney as well as the left suprarenal gland above it, and the end part of that, which you can see, this is nothing but the spleen. And then these two are nothing but superior mesenteric artery as well as a superior mesenteric vein. These are present anteriorly, like from behind they come out like this. And this is nothing but the splenic flexure of colon, and this is nothing but the duodenal jejunal junction flexure. This is duodenal jejunal flexure, and this is the pancreas. So this diagram is very important, and I want you people to remember this diagram and visualize it. So the next thing is the relations. So first we talk about the head of the pancreas. See here, the head of the pancreas has 3 borders and it has 2 surfaces. Okay, so the 3 borders, it is nothing but the superior border, the inferior border as well as the lateral border. So the superior border relation is nothing but the first part of the superior border is related to the first part of the duodenum. You can see it in this diagram. So, and as well as along with that, you need to remember that superior pancreatico-duodenal artery also comes there. It's very easy to remember. Similarly, the inferior border, how is it related? Inferior border is related to the, yes, very good, third part of the duodenum. Along with that, see, above you wrote superior, so superior pancreatico-duodenal artery. In inferior you will have inferior pancreatico-duodenal artery. Coming to the lateral side is related to the second part of the duodenum. So along with that, now you have the anterior and the posterior pancreatico-duodenal arteries. Okay, so these are the relations of the borders of the head. Moving on to the surfaces. See, the head of the pancreas, what do you think the surfaces can be? There can be only two surfaces, the anterior surface and the behind that is the posterior surface. Now we will be looking at the relations of the surfaces. The anterior surface is related to the transverse colon and mesocolon. You need to visualize it that this is the pancreas, right? In front of it you will have the transverse colon like this and the transverse mesocolon moving like this. So these are nothing but the anterior relations, transverse colon and mesocolon. And then you have the jejunum. See, this is the duodenum. The next part of the duodenum will be jejunum, right? So you can remember jejunum as well as superior mesenteric vessels. This might be, if you tough to remember, but these two you can see. This too you can see also, superior mesenteric vessels. You can see it in the diagram. So this is the anterior relations of the head part of the pancreas. That, and then you have the transverse colon, you have the transverse mesocolon, along with that you have the jejunum. Moving to the posterior relations. Posterior relations, you can see the head part. See, this inferior vena cava will continue it like this, right? So this is the posterior relation. Along with that you have the common bile duct, which will form the posterior relation, like the common bile duct that will come and join that. This is a posterior relation. Next, moving to the next part of the pancreas, that is nothing but the neck. The neck also has borders as well as surfaces. The neck part is like this, right? It also has superior border and it has inferior border. The superior border is related to the duodenum. The inferior border is related to the head of the pancreas. Look at this diagram. The superior border is related to the duodenum. The inferior border is related to the what? It is related to the head of the pancreas. Like it comes over here, right? So it is related to the head of the pancreas. Moving to the surfaces, it also has two surfaces, anterior surface as well as the posterior surface. The anterior surface is related to the pylorus. Let us try to visualize it over here. So I think I have drawn it over here. Okay, so the anterior surface, the pylorus of the stomach. The stomach will kind of come like this. So, and come and join. So the pylorus of the stomach will come on the neck part, like this, right? So this is where the pylorus comes. That is why we have written that the anterior surface of the neck is related to the pylorus part of the stomach, and the posterior surface is very important. The portal vein is related. This is the most important question that will be asked in the neck part. You should remember that behind the neck of the pancreas, that this is the pancreas, behind the neck of the pancreas you have the portal vein going. This is a very important relation that you should not forget at all. So moving on to the body of the pancreas. So the body of the pancreas is triangular in cross section, and it has three borders as well as three surfaces and one process. See, this is the pancreas. If we take a transverse section of it, you will be able to see something like this. So when you cut it, it has an anterior elevation. Usually from that time we were talking only about the anterior surface as well as the posterior surface, but when you take a cross section of the body part, you can see something this like this triangular surface. That is, it has a bend in the forward region, so therefore it will lead to three surfaces. That is nothing but the anterior surface, inferior surface as well as the posterior surface. I hope you guys understood this. It's like the body is like more three-dimensional, so you need to imagine cutting it in the transverse section, and we're taking the section and looking at it. So you will have three borders. That is, this is the anterior border, this is the inferior border, this is the superior border. This will be the anterior surface, posterior surface as well as the inferior surface, right? So this is nothing but like the sagittal section of pancreas. So now if we have to look at the relations, superior border. So look at the first diagram. We can visualize the superior border of the the superior border. It is related to the celiac trunk, it is related to the splenic artery, it is related to the common hepatic artery. I think I have written that only. Celiac trunk, the common hepatic artery as well as the splenic artery. This is how you're supposed to do in the exams. You just have to make sure that you draw that diagram very nicely and visualize it, and then you can just look at the diagram and write down the things. You don't have to by heart everything. So inferior border is related to the superior mesenteric vessels. We saw in the diagram, right? This is the head of the pancreas and they were coming out like this. So the inferior border of the body of the pancreas. This is the body. So it is related to the superior mesenteric vessels. Now the anterior border. The anterior border, what does it do? It provides attachment to the root of transverse mesocolon. So that is nothing but in this diagram. I told you the transverse mesocolon goes like this, right? So the anterior surface, it will be elevated like this. So this thing provides attachment to the root of your transverse mesocolon. It's very important to remember, and usually people tend to forget that. That's why I have written it in a different color so you don't forget it. Provides attachment to the root of the transverse mesocolon. This is the anterior border. So we are done with the borders of the body of the pancreas. Next, and it is very easy. You just have to look at the diagram and you can write this. Superior border is celiac trunk, splenic artery as well as the common hepatic artery. Inferior border will be superior mesenteric vessels. The anterior border, which is you have to remember, provides attachment to the root of transverse mesocolon. These two though, you can look at the diagram and write. This you need to remember. Next is the anterior surface. Look, so this is I told you, right? So here above, like the anterior part of the pancreas, you get the stomach like this. So you can remember the anterior surface of the body of the pancreas. What you get stomach, and like behind the stomach, which separates it from the pancreas, is nothing but the lesser sac. So you need to remember these two. Stomach is related to the lesser sac also, right? So you can remember the anterior surface of the body of the pancreas is related to stomach as well as the lesser sac. And then the posterior surface. The posterior surface is, if you look into that diagram again, you will notice that the posterior surface is related to the aorta, the origin of the superior mesenteric artery, the left kidney, left suprarenal gland, and the splenic vein. The splenic vein, you could see the splenic artery in the diagram in this way. This is the splenic artery. The splenic vein is present behind the pancreas. So that is why it is a posterior relation of the body of the pancreas. So the posterior relation of the body of the pancreas, if we see, you have the aorta, and then you have the origin of the superior mesenteric vessels, you have the left kidney, you have the left suprarenal gland. Along with that, over here you can see the splenic vein passing through in the posterior surface of the body of the pancreas. I hope this till here it is very easy. I mean, the next also will be easy. The inferior surface is related to the duodenojejunal flexure, the coils of jejunum, and the left colic flexure. See, this is the diagram that you can see. This is the pancreas. The inferior surface is related to the duodenojejunal flexure, that is this thing. The coils of jejunum are also found over here only, and then you have the left colic flexure. So you need to remember this diagram, and it is very easy to remember, right? This diagram is easy, so if you remember this diagram, you can write these three easily. So the main part of pancreas is the relations, and in the relations also, the main thing to remember is about the body of the pancreas. So now we are done with that, because neck is very easy, and the head also you can see and you can write. So body is only something. Body also is easy because you can see and you can write only. So the next part is the tail of the pancreas. The tail of the pancreas, first we'll read about the features of the tail. It is the only peritoneal part in the lienorenal ligament. It is the mobile part of the pancreas. It is mobilized during splenectomy. It has the largest collection of islets of Langerhans. So therefore it is very much important to conserve it during splenectomy. So during surgery, we have to be very careful. We cannot just remove this part, the tail of the pancreas, because it has the largest collection of islet of Langerhans. So next, this is nothing but the relation of the tail of the pancreas. It is related to the hilum of the spleen, and it is also present between the gastric and colic impression. So if you don't know what this is, you will be learning about it in the spleen. When you read about spleen, on the spleen you have the gastric as well as colic impression. In between these two, you will find the impression of the tail of the pancreas. Moving to the ducts of the pancreas. So pancreas has two ducts, okay? The main pancreatic duct as well as the accessory pancreatic duct. The main pancreatic duct, moving on to the main pancreatic duct, it begins at the tail. So it begins like ulta. It's not, you think it begins like this. No, it's not beginning like. It begins at the tail of the pancreas and transverses the whole length of the gland. So it is beginning like ulta. From here it is beginning and it travels through the whole length of the gland. At the neck, it turns downwards and enters into the second part of the duodenum. So this is like the neck part. It turns downwards and it enters into the second part of the duodenum. Here we had the duodenum, right? So then over here it joins the bile duct as it pierces the duodenal wall to form the hepatopancreatic ampulla. This is also known as the ampulla of Vater. I think everybody knows this because we've been studying about this since from, I don't know, grade 9 or grade 10. So it joins the bile duct as it pierces, or in 11th or 12th. So it joins the bile duct as it pierces the duodenal wall to form the hepatopancreatic ampulla, which is also known as ampulla of Vater, which opens into the major duodenal papillae. Okay, so this hepatopancreatic ampulla, where does it open? It opens into the major duodenal papillae, which is situated 8 to 10 centimeter distal to the pylorus. The pylorus of the stomach. From the pylorus of the stomach, it is present 8 to 10 centimeters distal to it. In 90% of the cases, it is the only duct. So in 90% of the people, 90% of the people do not have an accessory pancreatic duct. They only have one duct, that is nothing but this, the main pancreatic duct. So what is this? This is known as herringbone pattern. What is this? This is nothing but the pancreatic duct. It receives tributaries at right angles along its long axis throughout its length. So this is the pancreatic duct. It receives tributaries like this, right, at right angles. Like at right angles, it receives tributaries. So this we call this pattern as a herringbone pattern. So this was all about the main pancreatic duct. Moving on to the accessory pancreatic duct, it begins at the lower part of head. See, this one begins ulta now. This begins from this side, the lower part of the head. That one was beginning from the tail. Okay, so it begins at the lower part of the head, runs upwards and medially, crossing in front of the main pancreatic duct. It crosses the main pancreatic duct. Then it opens into the second part of the duodenum. This also opens into the second part of the duodenum, but where on the minor duodenal papillae, the main pancreatic duct was opening on the major. We just saw where yes, very good, 8 to 10 centimeter distal to the pylorus of the stomach. So where is this opening? This is also opening in the second part of the duodenum on the minor duodenal papillae, that is 2 to 3 centimeters above the opening of the main pancreatic duct. So just now we talked about the main pancreatic duct, right? So they are telling wherever the main pancreatic duct opens, 2 to 3 centimeters above that only I am opening. Who is opening? The accessory pancreatic duct. But where does it open? On the minor duodenal papillae. In 40% of the cases, what happens is that it communicates with the main duct while crossing it. Both of these ducts join together in 40% of the cases while it is crossing it. Moving on to the arterial supply of the pancreas. Please do not mind my handwriting in this, but I hope it is understandable. So this you have to draw this diagram. It is very important, and if you know this diagram, you can write everything on your own. So this is the pancreas. This is your celiac trunk. From the celiac trunk, you have the splenic artery. See, you know half of this diagram because you know the first diagram. So that is why I kept telling that it is very important for you to know the first diagram itself, the first diagram that we discussed. So this is the celiac trunk, this is the splenic artery, this is the common hepatic artery, and from the common hepatic artery you have the proper hepatic artery coming. This is GD is nothing but your gastroduodenal artery. I have written the full forms of this below, do not worry. And then this is nothing but the superior pancreatico-duodenal artery. This is the inferior pancreatico-duodenal artery, which is coming from the superior mesenteric artery, right? So these 1, 2, 3 are, I have written it below. So these are nothing but the branches of the splenic artery. So this is how it is. The celiac trunk divides into splenic artery that we just saw, which is nothing but which provides the main supply to the pancreas, and those 1, 2, 3 those are the branches of the splenic artery. They are nothing but arteria pancreatica chordae, arteria pancreatica magna, and dorsal pancreatic artery. So these three are the branches of the splenic artery. You need to remember this: arteria pancreatica chordae, arteria pancreatica magna, and dorsal pancreatic artery. So from the common hepatic artery, again we have two branches, that is the proper hepatic artery and the gastroduodenal artery. The gastroduodenal artery further continues as the superior pancreatico-duodenal artery, or it divides into superior pancreatico-duodenal artery, which further divides into the anterior division as well as the posterior division. The above mentioned arteries are all arteries of the foregut. Okay, all these arteries that I talked about in this flowchart, they're all arteries of the foregut, and the below mentioned arteries are the arteries of your midgut. So what are these arteries? This is nothing but the superior mesenteric artery and a branch from it, that was inferior pancreatic or duodenal artery. So this is the blood supply of your pancreas. So this diagram is important. This flowchart you can write it on your own if you know the diagram. So moving on to the venous drainage. In the venous drainage, we are gonna be the venous drainage to the pancreas is provided by the portal vein, the superior mesenteric vein, as well as the splenic vein. You already know this. I told you about the splenic vein where, yes guys, try to remember, I told it to you in the posterior relation of the body of the pancreas. That is where the splenic vein we have read, superior mesenteric vein, so we all know, and then as well as the portal vein. Yes, tell me what was the relation of the portal vein to which part? The neck of the pancreas का posterior part was related to the portal vein. Right. Moving on to the nerve supply of the pancreas, the sympathetic nervous system, it arises from T6 to T10. So these the nerves arising from T6 to T10 provide the sympathetic nervous system supply to the pancreas, and parasympathetic nervous supply is given by the posterior vagal trunk, that is the right vagus nerve. You just have to remember the nerve supply in this. Okay, T6 to T10. Tell me the location. What was the location? If you guys remember, I think it was from T12 to L3, right? Yes, this was the location of the pancreas. Moving on to the lymphatic drainage. The lymphatics from pancreas mainly drain into the following groups of lymph nodes. That is, all the lymphatics that come from the pancreas, they all drain into these lymph nodes. What are those lymph nodes? The pancreatico-splenic lymph nodes. Yes, it's very easy to remember. Pancreas and spleen are like this only, so you can remember pancreatico-splenic nodes, the celiac nodes, the superior mesenteric nodes, and the pyloric nodes. So it's very important to remember these. What is the lymphatic drainage? It drains into the pancreatico-splenic nodes. Then you know about the celiac nodes, superior mesenteric nodes, as well as the pyloric nodes. The development of the pancreas is very important. This is the second last topic of pancreas. Next we have applied anatomy still left. So the development of the pancreas is very interesting also, and it is also very important. So if you have you will also read the development of the pancreas again, probably in more detail in embryology, but for now we will study it. So it develops from two buds, okay? The ventral pancreatic bud as well as the dorsal pancreatic bud. I'll change the color of this. Yes. So yeah, it develops from two buds, ventral pancreatic bud as well as the dorsal pancreatic bud, and it has two ducts. The ventral pancreatic bud has two ducts. Therefore it has two ducts. Okay, because this is all because of change in color only. So yeah, so it develops from two buds, ventral pancreatic bud as well as the dorsal pancreatic bud there, and that is why it has two ducts. Okay, now the ventral pancreatic bud, it is smaller and it arises in common with the hepatic bud of liver, and the dorsal pancreatic bud, it is larger and it arises more proximally directly from the duodenum. I have drawn the diagram for you so that you can understand it more nicely, but for now you just read this along with me. And the ventral pancreatic bud, it forms the posterior part of the head as well as the uncinate process. You need to remember this. The ventral pancreatic bud, it forms the posterior part of the head and as well as the uncinate process, and the dorsal pancreatic bud usually forms the remaining part of the whole gland. You will look at this. So look at this diagram, it will be more clear now. So this is the dorsal pancreatic bud. This entire thing is the dorsal pancreatic bud. This is the bile duct, and this is the ventral pancreatic bud. As I have mentioned here, the ventral pancreatic bud is smaller, as you can see, and it arises in common with the hepatic bud of the liver. And then the dorsal pancreatic bud is larger. It arises more proximally directly from the duodenum. This is the dorsal pancreatic bud, ventral pancreatic bud. So this is how it is present. Next, what happens is, after the rotation of the gut, what will happen? This ventral pancreatic bud will come and it will sit here. And now what will happen? After that, what will happen? These two ducts will join in. Okay, and that is how the development of pancreas takes place. So let us read about it. Following the rotation of the gut, the ventral pancreatic bud passes along with the bile duct into the position dorsal to the dorsal pancreatic bud. It moves dorsal to the dorsal pancreas. This is the dorsal pancreatic bud, right? It moves behind it, dorsal to the dorsal pancreatic bud along with the bile duct. So look over here. The bile duct was also this side. These two together flip because of the rotation of the gut, and they come this side and they lie dorsally to this also, dorsal pancreatic bud. That is behind it, is what I mean. Now next what happens is the two ducts now fuse, that is figure B. As I've shown it with this red marking, these red dots, these two ducts will fuse with each other. So these two ducts now fuse and the ducts anastomose in such a way that the duct of the ventral pancreatic bud will form the proximal part of the main pancreatic duct, and the duct of the dorsal pancreatic bud will form the distal part of the pancreatic duct. Yeah, you can look at it only until this is the ventral pancreatic bud, right? From here they are telling the ventral pancreatic bud will form the proximal part of the duct. Yes, this is the proximal part, so it will form the proximal part when it joins, and this will form the distal part of the duct. Okay, now so next, the proximal part of the dorsal pancreatic duct between the anastomosis and the duodenum narrows and forms the accessory pancreatic duct. Look at the proximal part of the dorsal pancreatic duct that is present between the anastomosis of the duodenum, between the anastomosis and the duodenum. That is, we are talking about this part. So this is the proximal part of the dorsal pancreatic duct that is present between the duodenum as well as the anastomosis. This will form your accessory pancreatic duct, is what they are telling us. Form the, I hope the development is very clear, and whatever I have written here now, it makes it very easy for us to understand about these diagrams also. If you know the diagram, you can write it on your own. First this is how it will be present. You need to tell dorsal and ventral, and then because of the rotation of the gut, it arranges something like this, and then these two ducts will join. That is, the ventral bud will form the proximal part of the pancreatic duct. See, the ventral pancreatic bud from the proximal part of the main pancreatic duct, and the dorsal part pancreatic bud will form the distal part of the pancreatic duct, and the part that is left out in the proximal part will form the accessory pancreatic duct. So the applied aspect, this is very, very, very important, because we are learning about anatomy so that we can apply it in real life in patients. When you go to hospitals, like from next year you will start going to hospitals, and you will realize how many cases of acute pancreatitis you will see. So that is why knowing the anatomy of pancreas is very important. Acute pancreatitis is nothing but the inflammation of pancreas. It is mainly caused because of obstruction of pancreatic duct, or it can be caused because of consumption of alcohol. This is like, you will see a lot of cases in hospital who come with acute pancreatitis, and they consume alcohol like a lot. So consumption of alcohol is one of the cause. Obstruction of pancreatic duct, viral infection like mumps, as well as trauma. So these can lead to the acute pancreatitis. So what will happen in this is, the activated pancreatic enzymes will leak into the substance of the pancreas, and it initiates auto-digestion of the gland. So whatever because there is blockage of duct or anything like that, the pancreatic enzymes will start leaking, and what will happen, it will start digestion. It will start the digestion of its own gland. So that is nothing but auto digestion of the gland. Okay, so clinically, what can you see in the patient who has pancreatitis? He will come with severe pain. Where? In the epigastric region. Why epigastric region? Come on, tell me. Because we read in the location, that is where pancreas is located. So he comes with severe pain in epigastric region, which usually radiates to back, with fever, nausea and vomiting. And in that patient, if you see, you will be able to see serum amylase level, that is, it is raised 4 times. Okay, this is very important in diagnosing acute pancreatitis, because there can be many other things that can have happened to the patient due to a pain in epigastric region. If you look at his serum amylase level, that you will see that it is raised 4 times. So the next applied aspect is nothing but carcinoma of the head of the stomach. What happens in this is that it compresses the bile duct, leading to obstructive jaundice. Because of compression of the bile duct, it will lead to jaundice. That is nothing but obstructive jaundice. It may press the portal vein or may involve stomach due to close affinity. So this can also happen. So with this I have completed the entire pancreas. Thank you for watching this video. If you like it, keep watching more videos and like the video. Thank you.